really nothing that we can do anything about. PSERs and things like that are decided at the state level. We have to live with it. The debt isn't even like kind of a real debt. I try to discuss it with Ed and it's like very nebulous. I'm like, when do we pay it off? And it's like, never. It's like this thing that exists. It's $3.6 million a year. We get reimbursed, correct, Ed, about half. So we have to pay for 1.8 million. And when you were in a presentation with PASBO, they're saying that these costs are going to escalate until like the year 2035. I think a couple of years ago, Governor Wolf had changed the makeup of PSERs and that the younger personnel that are coming in are more in a traditional 401k setup. Is that correct?
It's not.
Or is that?
But there's different contribution rates and it's managed differently.
It's a 403B, isn't it?
No, it's still PSERs.
Oh, okay.
An employee can opt into a 403B, but it's still.
All right, so they have two choices.
You have to use PSERs as an employee, a state employee in the school system. But you can opt into additional retirement in a 403B if you so choose.
Oh, okay.
The contribution rates are different for anybody incoming into the system. Like because
They
I
have to
started
pay
a year
more.
ago, yes, I got to pay more than what probably somebody who's been here for 20 years was contributing.
So they did change the rules to try to ease up on the unusual escalation that's happening. But what's our percentage now? Like 34%?
It's over 35.
It is over 35. So it's going to escalate until the year 2035, and then after that, that's when we're going to start to see some relief. Next slide. The other thing that is before us is the employee contract that expires at the end of this school year. And what we've been hearing, and we have seen evidence of that, is that if you take our salary schedule and you compare it to the other districts in Carbon County, not Panther Valley, but if we look at like our close neighbor, Palmerton, our salary schedule is behind theirs, and some staff members are leaving because of that, or when we're in the process of hiring, there are obviously people are interviewing at different locations, and then they get offered more money, and we're not obtaining these employees. So we're having a problem with retention and hiring because of the salary schedule, and that needs to be repaired. And repairing the salary schedule means more money, obviously. Another complaint that I've been hearing or had heard in the past is that there's a problem with supplies, but I believe that has been fixed. And I know, Ed, that you and Jack have been working with the staff to make sure that they are getting the supplies that they need, and my understanding is that's in the new budget cut.
Yes, correct. We made that change last year. And we used $163,000 in supplies in the buildings. And that's, again, continuing for the planned budget.
Okay. Next slide. Another challenge, which we've already been talking about a little bit, is that over the past 7 years, really in the last year, there's been a real scale back of the number of employees that we've had. 10% reduction in staff. We've lost some classes, we've lost some services. This is Ed's table from the last presentation, and I just added an enrollment line, and that was for myself because I was thinking about what's happening with enrollment, and our enrollment in this period has been pretty darn flat. If you take the average of those numbers, it's flat. I mean, it looks like today that it's gone down some, but to me, that's more of an anomalous data point.
What's I just can't read the final number. I'm losing my eyesight.
Oh, 310?
Thank you.
310. And then that's what brings up the discussion, where Jack had talked to staff here, and, and there's requests request to add 10 new positions. I believe there are positions we've had before, and we just want to add them back in. And it's a challenge, because when we add them back in, it's going to increase the budget.
Can I ask you a question? We've got 310 total staff in the vector
That's
solutions.
2019, 2020.
What do we have currently?
200 and, top of my head, 253.
So what's the
That's everybody?
425 users in the vector solutions contract? I'm just going back to the last board meeting, sorry, it's not up there, but we're paying, or at least the contract has 425 users. If we've only got under 300,
We also do the best company of school bus drivers, so anyone who has any interaction with students, so we,
Any coaches?
any coaches, school bus, all of that, so that's that extra group coming in.
Next slide. Another thing that we don't need to think about this year, but we're going to need to start thinking about, we should be thinking about it now, is we have some significant grants, and the grants cover staff, their benefits, we've got programs and extra services that are offered to the students. From what I've seen from your spreadsheet, Ed, I just updated this before, but about 1.3 million of that really gets renewed every year. We redo the paperwork. But at the end of next year, the ESSER 2 is going to expire, and we're going to lose $930,000 of revenue. Yeah.
Is that an annual amount, or is that the total that the grant was overall?
No, it's annual.
Okay.
The total of the grant is a lot more, and then it got split up over several years, but this school year...
That's a one-year number.
Correct, that's what we're using
That's
for a single year.
employees, salaries.
Yeah, and then in 2 years, the ESSER 3 is going to expire, and that's like a big guy, because this year, we're using $2.4 million out of that ESSER to pay for psychologists and social workers and after-school programs and what's it called, catch-up learning,
Learning loss.
learning loss. And there's a lot of stuff in that. I mean, that's not going to hit us till 2024, but we need to be thinking about it. We don't want to pretend it doesn't exist and then 2 years from now say like, holy cow, we have a $2.4
We have
million.
9 more employees to integrate into the budget, and that's,
Correct,
yeah.
correct.
how many are we supporting with the ESSER 2?
What's that?
How many employees is
I think
the
it's
ESSER 2
9.
covering? Is it 9?
I believe it's 9.
Where is
That's
this
almost 100,000.
online, or where's the report that you created? The presentation you're using, do we have a copy of it or anything?
Not yet.
No, I can give it to you for sure.
Okay.
Yeah, and I've got backup data behind this. I mean, I've been researching this for the last month. I mean, I wasn't at the last budget meeting because I had COVID. I don't know if Jack told people, but I was really sick in March and I was participating virtually. And then last month I've been trying to get on top of these things so that the board can make decisions. Next slide. The other special challenge, and we can't really talk too much about it, but it's the employee health care. Mr. Sultanic has told us that it is the richest health care plan that he knows of in the state of Pennsylvania within the school districts. There's low co-pays, low deductibles. These two charts came from BSI, who is managing our healthcare portfolio. It's really hard to read the chart on the left, but you had presented at the last budget meeting. So the typical actuary value of a healthcare plan is about 85, 86, 87%, and ours is 97%. And the other thing on the right side that Ed has tipped us off to is we have an unusually high number of family plans, and that's sort of like a secondary effect of having a very rich plan, right? Because when employees have a spouse and they say to themselves, well, we're gonna opt into one plan and not opt into the other, they're gonna opt into the richer plan, of course. And so kind of a secondary effect of having a rich healthcare plan is it's attracting additional families onto the plan and then just creating more burden. And this graph is from BSI. And, you know, this is a function of a lot of things, not just our healthcare plan, but sort of what's happening in healthcare in general. And they're saying that healthcare costs for everyone is going to be escalating, every single school district. But they're predicting that in 5 years, if we were not to do anything with the healthcare plan, that we would have an escalation of more than $2 million. So, just racking up, yes, Dave?
Sorry, keep going, I was just gonna, when you have time, is that number in the bottom right? That says the word BSI. What's the bottom right number of the number of people on this healthcare program with 300 employees? How many people opted in?
I believe it's 214 in this particular graph.
I think that's what it is, yeah.
Yeah.
So you have 300 employees plus an additional 214?
No.
Just a total of 214 people on this Cadillac Rolls-Royce
And
plan.
part-time employees don't get the
Employees
healthcare.
enrolled, but then you have all the family members that go.
Yes, that's what I'm trying to question. How many employees are eligible, and of those, how many family
All
members
employees
are?
are eligible to
Okay,
participate in the plan. Not all employees choose to use the plan, which would be reflected in that number there, which I believe is 214.
well, we can't read it from here, so.
Yeah, I said it's 214. Yeah, 214. So 214 participate in the plan.
Do our part-time,
Our part-time employees do not.
right, so whoever's part-time would not be reflected in that.
So you have 214 employees, of which how many of those have eligibility? How many total employees have eligibility to this plan?
Everybody that's not.
Part-time, yeah, I
that's
get
not
that. So
part-time.
what is that number?
I don't know off the top of my head.
Okay, and then you take how many actually apply, and then from there, you have 214 employees in the plan. How many family members attached to that 214 employees